Hey everyone, I'm Dr. Keith Latson, an equine veterinary surgeon.
And I'm Dr. Rob Franklin, an equine veterinary internal medicine specialist. And today, Dr. Keith and I would like to share with you guys some tips on colic. So thanks so much for joining us on the Full Bucket YouTube channel. Keith, tell me about colic in your world.
Colic, oh boy. Colic in everybody's world, I think if you have horses, is one of those words that we think of nightmares. It's expensive, it's tough on the horse, it's tough on the horse's performance, it's tough on the veterinary teams and veterinarians who are treating horses with colic. But there's a pretty good chance that if you have a horse, at some point you're going to have to deal with a case of colic, be it mild to severe. And being prepared for it and knowing what to do when it strikes is really critical. Excluding old age, colic is the #1 killer of horses or cause of death in horses. And so it's one of those things that we can either be really fearful of or we can be really prepared for.
Yeah, the majority of the cases are mild and they're easy to resolve. And if you know what to spot and how to treat it, your horse is almost guaranteed to come out unscathed, minus the subset of really complicated, what we call surgical emergencies. So in this video, we're going to break down what colic is, show you some of the early warning signs that may be setting in, and the best way to prevent colic issues from surfacing. So first things first, tell me, what is colic and what does it look like?
Yeah, colic, it's just abdominal pain. I mean,
Okay.
It's a word that means abdominal pain. Where and how that abdominal pain happens is, there are hundreds of reasons. As you and I both know, we've treated thousands of cases of colic together, referring back and forth, or independently. Me at the racetrack with horses that maybe ate too much grain. Or horses that were dehydrated and had an impaction. Their feet got balled up in their intestines, and so they were constipated, so to speak. So colic is just that general term for abdominal pain. It can come from gas, it can come from feed accumulations, it can come from a mechanical twist in the intestines. So it can either be obstructive, meaning that there's something blocking the intestinal tract, or it can be non-obstructive. So it can be from inflammation or some other things where you don't have a physical blockade of the intestinal tract.
Yep. And that's a good way that we commonly think about it as a veterinarian. We think of obstructive versus non-obstructive, and then we think about, small intestine versus large intestine. Very occasionally you'll get a stomach colic. Most of those are low grade and they're more related to stomach ulcers, and where that's again, a low-grade colic. Many times those horses just aren't eating well. They may be lying down occasionally, looking at their sides. But the classic, colic we think about typically occurs in the small intestine, which is about 70 feet long. And that is the part that is involved in the enzymatic digestion of your food. And then we think about the large intestine, which is the hindgut in the horse. And that is a very problematic area of the horse. The way it was designed, it's really set up for failure in a few spots. And again, as we talked about in the video about caring for your horse during the winter and how important it is to keep your horse hydrated. Remember that large intestine is the sort of the reserve pool for fluid, and so when a horse gets dehydrated or whatever, it begins to take fluid out of that large intestine, which can lead to large intestinal colic, such as dehydration and impaction that you mentioned. And then there's those intestinal accidents that we commonly refer to them, and they're not necessarily set up by anything, but that may be the twist. It may be where the bowel gets trapped in a certain part of the abdominal cavity. You get some of those fluke deals, and let's face it, we see them, and oftentimes those are surgical emergencies. So let's talk about signs of colic and what people may see as far as a spectrum in the common signs.
Sure, I think a lot of the early signs of colic often can be missed because it really takes watching a horse for some period of time, because we're not looking for a single specific activity, but maybe we're looking at a behavior over time. Is the horse lying down for longer than you would expect it to be? Is it rolling onto its side and then rolling up, just sitting up? And that's something that a horse that is lying down to sleep maybe doing if you only look at it one time. But if this horse is doing it over time, back and forth and back and forth, that may be a sign of discomfort. It may be just stretching out, like the horse needs to urinate and it's not producing any urine. These are some of the more mild signs of colic. As we progress, we start seeing horse flank watching. It'll look back at its sides. Maybe it's stretching out and looking back at its sides at the same time. Maybe not. Maybe it's actually biting at its side, physically biting at its sides. And some of these signs we have to take into account the horse itself, right? Some horses have a really high tolerance for pain, and they'll ignore their own signs of abdominal pain for days. Other horses, just at that little flicker of discomfort, they are throwing themselves on the ground and acting like they do have one of those abdominal emergencies. So knowing our horse and taking that into account is important, but also knowing what the progressions of signs over time can be. So after you get beyond that flank watching or biting at the flank, you'll get a horse that starts kicking at its belly. It'll start going down, standing up, rolling, to the point that it may be thrashing around. These are horses that absolutely critically need to be seen by a veterinarian. Those early signs, maybe you know your horse has a history of gastric ulcers or low-grade colic that has resolved with a certain combination of things you've done in the past. So you can try those things, but this is never something that you want to wait on.
Right. I think that's a big deal is in understanding that spectrum of diseases is as the disease is more pronounced and the horse is violently rolling around, won't stand on its feet, you need to call your veterinarian. That can be a sign that there's a very, very serious problem going on, and quite honestly, time is of the essence. As a surgeon, absolutely. I know that when you have to operate on a horse that has been, for colic, that's been colicking for some time period, especially it's one of those situations where the blood supply of the intestine has been interrupted. You know, if you get that horse 3 hours after the colic starts, that may be too late and you've already may have to put the horse down, or you may have to remove part of the intestine, where if you're able to address it right away, you know, you can perhaps salvage that part of the intestine, or the horse has a chance, it hadn't gone into such severe shock that you can actually save it. So recognizing that severe spectrum is key. Again, knowing those subtle signs, I always recommend just even to give your veterinarian a call and just to talk to them. They may instruct you to take a few vitals or to call them back in a little bit and see if it's passed. It is very common. Perhaps the most common thing is a gas colic. It's sort of that gas bubble that sometimes we get when maybe we ate a little too much of the Mexican food or travelers sort of situation. But it's sort of, you feel that gas bubble. Well, that gas bubble can be magnified in a horse where it causes severe pain, but that pain tends to be very transient. So it may be severe and then it goes away, or it may be mild and after a little bit of time it goes away. And so that's where we start talking about some things that you may try that are not medical, and we call these like home remedies and stuff like that. And probably the most common one that we talk to, and I think there's always good here, but there's spectrum, is walking the horse. So many times, people at the barn will say, "Oh, my horse is colicking," and someone else at the barn will say, "Walk it." Well, I think that's great, but what I don't like is whenever someone has been walking their horse since 8 p.m. and it's now 8 a.m. the next day, and they call me and they say, "Hey, my horse is colicking, we've been walking it all night." By the time I get it, the horse is so dehydrated just from the process of walking, and whatever situation was going on has just been stretched out for 12 hours. So to me, the walking thing is, yes, take your horse for a walk. Absolutely. If I'm on my way or you're waiting on a truck and trailer to take your horse to a clinic, then you can walk your horse. But I just don't like to see that process exaggerated, especially without calling the vet and at least letting them know what you're seeing. And the vet may say, walk them for a half an hour and then give me a call. But just don't walk them all night before you call us.
Sure, and one of the things that I really like to do, we've got a fly that's here that's sort of like Biden in the debate, and I'm feeling him landing on my hair. But one of the things that we often do with our horses that have low-grade colic is just walk them for about 10 minutes or so and then put them back in the stall and observe what's their behavior. Then take them back out 30, 45 minutes later, give them another 5 or 10 minutes of hand walking, put them back in the stall and observe. This can accomplish a couple of things. One is it may stimulate some motility in the intestines just by having them moving around, and then just let them relax in the stall as much as they can. It's a really important cycle, not just for allowing those intestines to begin moving and moving some of that gas bubble back, splitting up that gas bubble as the intestines sort of massage it back. That's the hope, right? But it also gives us the opportunity to watch the horse and assess whether those signs of colic are getting more severe. And that's the point oftentimes at which we make the decision to call a veterinarian.
Yeah, and I think just along with the walking comes the trailer ride. So that's probably the second most common thing that people do. And I get it. I'm not against trailer rides. Again, you know, I never mind if people call and say, hey, you know, old Yella just started showing some mild colic signs. We're gonna, you know, give him we walked him for 5 minutes. We're gonna give him a quick trailer ride, see if that fixes. And I'll say, okay, tell me a little bit more. And then I may say, okay, yeah, do your trailer ride and then call me when you're done. The trailer ride should be like the walking. It should be brief. Don't drive them across the state or drive them all night or, you know, just wear the whole thing out. The whole idea is that just like walking around, you're going to jostle that intestine a little bit and you're hoping to shake a gas bubble loose. A trailer ride or walking is not going to necessarily help a horse that has an obstructive lesion, meaning something blocking the intestinal tract. Even a simple impaction, you're not going to loosen that up by a trailer ride or by walking the horse. You're hoping that it's a common gas colic and just that movement can stimulate that bubble to break up as you described. So trailer ride's fine, don't exaggerate it, just like the walking. Bring them back, let them drink something, and that probably leads to the next thing is like feeding them or not feeding them, you know, water, no water. My personal opinion is leave the water out. If they want to drink, let them drink, but when it comes to food, I don't want them having any food until the colic is gone.
That's right. We've heard over the course of our careers as veterinarians a number of natural remedies that our clients have brought to us or that Dr. Google has presented to our clients. And so we really wanted to address a couple of those, asking the question, natural remedies for colic, do they really work? The first one is mineral oil. And we use mineral oil in our clinic. In fact, there are a couple of gallons of it right over there behind the camera. We use that relatively routinely for horses that come in with low-grade colic. I only ever use it using a nasogastric tube. Really important here, because if you're syringing mineral oil into your horse's mouth and it gets some of that mineral oil down into the trachea and into the lungs, it can cause a pretty raging pneumonitis and even death. So this isn't something to try at home. This is something for your veterinarian to use after he or she has passed the nasogastric tube and has confirmed that that tube is in the stomach. By a number of techniques, we do that just to ensure that it's in the right place. We're delivering the oil directly into the stomach so that it can pass back into the intestines and hopefully lubricate those intestines and sort of take place of that dehydration that often is there by creating a slippery environment for the digestive to go through or the feed to go through. So something that we use in the clinic. Absolutely don't recommend that it be used at home. Yeah,
you really can't give enough if you're trying to syringe it, and if you were to actually get enough in there, you're going to force some of that down the windpipe. So it's not something that's to be used at home. The other thing we do with that stomach tube is we check to see if the stomach's empty. Remember, the horse doesn't have the ability to vomit or to empty its stomach out. And so if it has a situation, which we see commonly, where the intestine is backed up and the fluid and the food is actually in the stomach and it's swelling, the stomach tube is actually there to relieve that pressure and to provide that what we call reflux, and so that we can empty off the stomach. And so if that horse has a very full stomach and you're trying to put more to it, you're probably making that situation worse versus making it better. So when we pass a stomach tube, we're always checking to make sure the stomach is empty, and then we give typically anywhere from 2 to 4 liters of mineral oil, which is way more than you can do with a syringe. So natural remedy number 2, let's talk about baking soda. So this is another ingredient some have tried to give as a horse colic preventative or remedy. However, baking soda really isn't likely to help because it breaks down in the stomach. It is combined with the acid, it goes away, and it won't offer a buffering effect in the digestive system after it does that. It may not necessarily be harmful, but baking soda most likely won't help in the treatment of colic, especially acute colic. And so overall, the verdict, don't use it. There are some supplements where you're using sort of a stomach buffer or hindgut buffer with the idea of trying to neutralize acid, but when you're having an acute colic episode, that's not going to be part of the situation. That's more looking at horses that have chronic situations where they may have gastric or hindgut ulcers where we're trying to neutralize that acid, but even baking soda does a poor job at that. You really need some of those pharmaceutical products to neutralize that acid.
Right, and a lot of the basis behind the use, at least in my experience with clients, has been that they're trying to buffer that acid in case their horse has ulcers, and I understand that. Ulcers also is one of those things you need the diagnosis. Right. You need the diagnosis. So work with your veterinarian to get the diagnosis. Don't try and treat gastric ulcers with baking soda. Natural remedy number 3. This may be our most favorite. Beer. I've heard a lot of trainers feed beer for the B vitamins, especially dark beer like Guinness. I have had only a couple of clients say that they were using beer to try and treat colic. How about you?
Yeah, beer is one of those things that, living in the South, is commonly used to treat anhidrosis or the failure to sweat. I know also people that use it on kind of a routine bran mash and things like that just to try to help soothe things. But the idea that you're going to stop pain or you're going to stimulate the intestine to start moving, or that you're going to neutralize something by feeding the beer is completely unfounded. So, for me, the only rational use for having cold beer is to maybe calm down your nerves while you're waiting on the vet to arrive. But I don't really think that's something that you need to be actively trying to force down your horse just in case it's going to provide some miracle, because it's not.
So the verdict on beer is
one for me, one for you. Save it for the beer.
Yeah.
For the horse. Yeah. So overall, there are definitely some home remedies. We have not given an exhaustive list at all for home remedies. You may, if you've been in a horse barn, you've probably found out there's an unlimited number of opinions and home remedies. Here's the big idea that I want everyone to realize, is that if you're going to have the ability to do something, either by putting pressure on an acupuncture point or walking the horse or trailing the horse, the thing you're going to have a successful outcome on is helping that horse get a gas bubble out of its gut. Okay, you are not going to help a horse with some of the more common and serious causes of colic, which would include an obstruction of the intestine, or a misplacement or a twist of the intestine. If you see anything where your horse is having consistent and escalating pain, you need to have it attended to by a veterinarian right away. And again, don't hesitate to call your veterinarian. Just describe what's going on. Have the ability to take a horse's temperature, have the ability to take their heart rate, have the ability to lift their gums, or lift their lip and assess their gums and look at the hydration status of the horse, and then notating the amount of manure that the horse may or may not have been passing recently, if you've had any feed changes, if the horse has been on any medications, or if you've been traveling with your horse. All those are going to be important things for your horse, its veterinarian, to understand, so that we can help arrive at a diagnosis and get your horse feeling better as soon as possible.
So preventative measures really for us, forage-based diet, plenty of clean, fresh water, plenty of exercise, routine exercise, and a lot of diligence watching your horse and getting to know your horse.
That's right. Caring for that GI tract is something that you can do every day, and it's kind of like Homeland Security. Hopefully you never see an accident, and that means that you're doing a good job caring for that horse's intestinal tract. We definitely recommend probiotics in any of the horses that are being kept in a in a sort of modern environment where they're being stabled, stalled, exercising in pulsatile sort of time periods where they're not out on a pasture just free ranging. If they're free ranging, their gut tends to take care of itself pretty well, but otherwise we're feeding them abnormal food, so we're feeding them hay and grains and concentrated meals such as pellets, and we need to take care of that gut, and the way you stabilize that gut is by feeding pre and probiotics such as the full bucket probiotic pellets, which can be a great addition to keep that gut healthy every day, and that will help prevent that horse from developing some of these catastrophic colic episodes that, you know, quite honestly, they're hard on the horse, hard on the vet, and they're hard on the horse owner.
Certainly. So really what this comes down to for us, we've talked about some of these natural remedies, it comes down to diet, diligence, and really optimizing the horse's intestinal tract. And the way that we have found to do that, and that we've developed to do that, is by using naturally occurring probiotics, prebiotics, L-glutamine to protect the intestinal tract. Our most strongest is the probiotic paste. And so oftentimes horses that are off, that their digestive tract isn't optimized after an episode of colic or a course of antibiotics, where they're at a little bit higher risk of colic, would be to use a course of the probiotic paste and then get on a daily regime of those probiotics.
Right. Yeah, the probiotic pellet is definitely something with a good balanced forage first diet that is going to help stabilize that gut and definitely decrease the incidence of colic episodes. So, you know, definitely check out fullbuckethealth.com and look at the probiotic paste to have on hand for emergency situations, and the probiotic pellets to be used on a daily basis to ward off those GI accidents. If you like this video, be sure and subscribe to the channel, and you'll get notifications for more exclusive content on helping your horse be and perform its best year-round.